any male from 20s or the early 20s till the 70s or even late 70s are ideal candidates. We have done so many cases in people who are in their 70s who want to look better, and we have done it in cases where the person has got a kidney transplant beforehand, the person is a diabetic and all. So in those cases we ensure the parameters are normal, and then we go ahead with the procedure and trust us that the results are going to be absolutely fantastic, as you can see in these pictures. So results in elderly are equally good, age no bar. The only thing that has to be taken care of is that the expectations are met and the donor area is good and the implantation is done in the correct way. When it comes to people in the early 20s, of course, the situation can be a little bit tricky if they're losing hair very fast. In those cases, we ensure that the hair fall stops, the androgenic alopecia is under control, and then we go for the hair transplant, and we ensure that they have lasting results till up to a decade or a couple of decades more.